Thank you very much, Deborah. It's a great honour to be here today to try and transfer some of my experience in this field to the families who've come along, and also to, I think we have some mental health professionals. So hopefully myself and Bob will make this an interactive and an interesting experience. So we're on challenging symptoms today. What can we do when the going gets tough? I almost saw you burst into song there, Deborah. So we're going to touch base with a number of areas today. First of all, we're going to talk about moods and strong emotions that, of course, can trigger exacerbations of psychosis. So what can we do when those strong moods, anxiety, anger, sadness, what can we do when they're involved with the challenging symptoms? Does our loved one have a really good coping strategy or not? But we're going to chat about that, because if we can optimize coping, that is a big start towards recovery. I know that many of the family members I've spoken to have found that the loved one being very deluded is a major issue. So we're going to talk about what we can do if your loved one has a very high level of conviction in a delusion, or a number of delusions that are all joined up into a seemingly impenetrable delusional system. We're going to have a look at that. What about when the loved one doesn't seem to make much sense? You cannot work out what they're trying to communicate to you. And of course, this is a great frustration. And the more frustrated that your loved one gets, sometimes the harder it is to understand the communication. So are there techniques we can use there? What about the voices that are very critical and lowering their self-esteem and maybe leading to self-harm? What can we do about those critical voices? And what about those slightly more risky voices that tell them to do things? These are all challenging symptoms for us as mental health professionals, but very much for families in the home. It's quite a lot to cover today, so I hope we're going to get there with us. And then there's the issue of, can we intercept relapse and prevent it from happening? Now, we actually know that families attending programs like this one are already very significantly reducing or delaying relapse. So you're already doing a bit of that, but there are some more techniques we can learn. And then we'll move on to a question and answer. So I hope that's okay if we meander through these areas today. Does our loved one show a pattern in their challenging symptoms? Now, there usually is a pattern there. Can we recognize what triggers it? And because if we can, we might be able to do something to prevent the trigger or work with it. And by doing so, preventing the worsening of the voices or the worsening of the paranoia. By dealing with the trigger, doing something different, or helping with the strong emotion. So it seems to be trigger, emotion, symptom. That seems to be the pattern. And thinking about your loved one, is that pattern there? It's very often happening in the background, and it might not have been recognized. So that this can be a very good way in. So we're going to show a bit of a very short video clip, I think about 3 or 4 minutes, to demonstrate such a pattern where there's trigger, emotion, and challenging psychotic symptom. Here we go.
So Tony, you're saying about how these voices make you so angry.
Yeah.
Can you think of a recent time when that's happened?
Well, yesterday, really,
Right, okay.
a really good example.
What was happening yesterday?
Well, I just come home, and
Mm-hmm.
I was dreading being at home my own, because well, I'd been looking forward to a friend, going out with a friend, but he knocked me back.
Right.
So I was back in my flat on my own, and I was kind of dreading
So
going in.
having been hoping to do something,
Yeah,
what, sort of feeling a bit disappointed and then
yeah,
being on your own?
yeah,
Okay.
yeah. I was feeling really let down. And then going into my flat, waiting for the voices to really kick off again, and yeah, they did.
So you're sort of sitting there thinking, right, they're going to start happening,
Yeah.
and then they did.
Yeah.
Okay, and then what happened?
Oh, I was just in such a state, because I was feeling, well, disappointed is putting it a bit mildly. I was feeling a bit cross with my friend because I was really relying on him for the afternoon to kind of get me out of myself, get me out of the flat, and then the voices started again, and I was just furious.
Okay, so then what did you do?
I started shouting at them to leave me alone, and I threw a cup at the wall.
Right, so you started shouting at the voices,
Yeah.
you threw a cup,
Yeah.
and how did that make you feel?
Well, I just felt awful because I was so out of control with it. I've been angry, been angry with my voices lots, but I don't usually, lose control like that. So I was feeling, so I was really, really angry, and then I felt really, really depressed.
So then what did you do when you felt depressed?
Well, I kind of went to bed.
Right.
After that.
And going to bed, how did that make you feel?
Well, I was really hoping that, everything would just go away and leave me alone, but the voices, they just kept on and on at me, and I was just listening to what they were saying about what crap person I was. And,
right.
Yeah.
If I've got this right so far, you'd been in a situation where you were hugely disappointed and pretty upset.
Yeah.
And you were on your own,
Uh-huh.
and you started to think, right, the voices are going to come.
Yeah.
And when you thought the voices were going to come, they did.
Yeah.
And that made you feel really angry.
Yeah.
So you threw a cup at the wall, and this made you feel even worse.
Yeah.
Okay,
Yeah.
so, and because nothing had changed, you felt really low.
Yeah.
And took yourself to bed.
Yeah.
And then that just made things feel even worse.
Yeah.
Right. So I'm just wondering what it was, whether it was the fact that the voices were there that bothered you, or more not being able to make them go away and feel like you could control them.
Well, it was, well, they were taunting me about my friend letting me down. But I think it was just the fact that they were there and they wouldn't let me be.
Right.
That's,
and regardless of what you did, you weren't able to reduce that.
Yeah.
I'm just wondering if that's something we can work on, but maybe looking at other options of what you could do to try and help yourself feel a little bit less taunted.
Yeah. Yeah. Well, that would be good, because that was pretty awful.
Mm.
So this was Tony's challenging symptom. He would get voices and they would start to shout, and the neighbours would be very unhappy about that. And then he would start throwing things around, which caused concern amongst the neighbours. The police would sometimes be called, and this happened fairly frequently. But in actual fact, there's a pattern here, isn't there? There's really quite a clear trigger. There's a clear emotion, And he then expects the voices to start, and the voices and his anger feed off each other and perpetuate themselves into this very challenging crisis situation. So what could a family member do? Well, could you do something with the trigger? So might Tony have had somewhere else he could go if he ever gets stood up again? Could he go to the local recovery college or a drop-in centre? Could we get him some other option? Could he have somebody else he could phone if this happened? Could he phone a family member who might come round and take him out? Or could we teach him techniques to deal with his anger and bring it under control? And that might be thinking thoughts like, well, he is a good friend to me, and there will be a good reason why he hasn't turned up. I'll get in touch with him as soon as I can, and we'll get it rebooked. Instead of that kind of calming thinking, Tony was thinking in a very angry way and blaming his friend, which triggered his anger. So here we see a very typical sequence of trigger, emotion, and psychotic symptom. And I just wonder if you can see patterns like that with your loved ones at home, and if you can figure it out in the kind of way that Sarah and Tony did in this role play. We'll need to wait and see when you think about that later on. What kind of triggers could there be? Well, Tony's was getting let down, someone behaving in a certain way. Watching the news is a major trigger. If you're already distressed, I don't know what you think of the news these days, but there's not much good news on there. It's all pretty stressful stuff. So I'm normally banning the watching of the news for people with psychosis and definitely for people with depression. Watching the news is a big trigger. Anniversary reactions, the anniversary of a relationship breakdown, the anniversary of a close friend's death, the anniversary of someone coming out of prison. The mind doesn't forget anniversaries. Or should I say, the brain doesn't forget anniversaries. The mind forgets them all the time, but the brain knows about anniversaries. Sometimes it's something as simple as they've just run out of money and don't know how to ask for a top-up of funds, so they can't buy food or whatever. Are there relationship problems round about them? Are they perceiving they're being criticized or controlled too much? Now, I have seen relatives who really, the best of intention, thought they were doing a great job, but the patient, their loved one, would say they felt controlled. And for that kind of situation, the befriending style, a change in the approach, can actually make quite a big difference. And sometimes as a parent or brother or sister, we're not always aware of how we're coming across. So it can be that that's a possibility. Doing too much for the person, being too kind is equally unhelpful. One of Tony's problems was isolation. He was really needing to get out and about more, so that's a factor. But people with psychosis have a number of health problems, and very often, of course, there's a delay in diagnosis. So if you have type 2 diabetes, that's a stress. And of course, that is quite common. What about allergic reactions of various types? A lot of people with psychosis went into a kind of long COVID sort of state after the pandemic. So is there a health problem that is triggering these outbursts? Poor nutrition or sleep habits. We know that lack of sleep is a powerful cause of challenging psychotic symptoms. And very often, loved ones aren't sleeping well because the room's too cold or too hot. It's something as simple as that. Or the bed's just completely uncomfortable. Or, as it often happens, they've turned day into night. Now, your hormone rhythms don't work that way. So that is a stress. Turning day into night does feel safer. There's less people about at night, so you feel a bit more relaxed in one way, but your endocrine system is baffled by it, and it stresses the system. And of course, some of the commonest triggers are around alcohol and drug use. So there's lots of different triggers there. And I mean, you'll know for your loved one and thinking about it, what the particular triggers might be. And sometimes there's a variety of different ones. But if we can detect that trigger, maybe we can do something about it. And maybe we can then link it to the emotion which accelerates the psychosis. Now, with psychosis, it's quite important to really be clear what the emotion is exactly. Anxiety and anger can look very, very similar. Depression and the negative symptom of emotional blunting can look very similar. So, but we need to really, I think we probably need to ask pretty directly, you look frightened just now. Am I getting that right? Is that what you're feeling? Or is it a different emotion? It's really important we understand what that emotion is. Okay, you're telling me that you're feeling really quite panicky, quite frightened. Is there a word or an image in your mind that can describe that feeling? And hopefully they can give you. Now, the words people use are extremely important. A famous phrase is, words are the petals of the soul. The words we choose are important. So I'm quite often very interested in writing down the kind of words that my patients, my clients use when they describe their psychosis. And of course, that's one of the reasons for keeping a diary. And anyone with psychosis who will keep a diary, just a page a day, writing down their experience, is already doing something to begin recovery. Diaries are very useful. If there is an image there, I wonder if they could draw it or they could paint it. That's an interesting idea. And just like Tony in the video there, what thoughts go through your mind? There's thoughts that my friend has let me down, and that he shouldn't have done that. That was a bad thing he did. So that's these catching these thoughts and maybe trying to change them. If there's an emotion there, can we score it? Whenever you score something, it starts to change. It's an old behavior therapy principle. Score it and it'll start to move because you've got a handle on it. Yeah, that panicky feeling, I'm going to give it like 7 out of 10. It's been worse, but it's been a lot better. Okay, so it's 7 out of 10. Let's see what happens to that score. Can we disclose times that we've been anxious and empathize with the feeling? That all helps. If it's anger that's the issue, important to make the situation safe, and if need be, take yourself out of the situation so that you are safe. Make the classic excuse of, I need to leave for a few minutes. I need to visit the restroom. If you need to get out of there to make any calls you need to make. Is there a safety plan in place for what to do when these challenging situations arise? Hopefully your mental health professional will have done one for you and your loved one. If not, then we should try to devise one. Now, Bob is furious because his brother Doug is staring at him. Now, this issue of staring is an important one. Many people who are paranoid think that people are staring at them. So, Bob, do you want to kick off this
Yes.
role play?
Doug, why do you keep staring at me? I can't possibly eat dinner when you keep looking at me like that. It's very upsetting. What's going on?
Bob, I'm sorry. I was actually looking at you. You're right. And you know what I was thinking in my mind? I was thinking, hey, me and Bob, maybe 30 years ago, we used to play pool regularly. Do you remember that?
I do.
I was thinking, I wonder if we should just get down to the pool hall and have another game of pool. It's a crazy idea. I know, crazy idea. What do you think?
Oh, I'd like that. I thought you were pretty angry with me.
Yeah, I can see how you would think that, because I was kind of looking at you in a slightly strange way, but it was because I was having that memory of those days, those happy days back in the pool hall. So you can see in this short role play that what I was doing was using a befriending response by linking. First of all, I validated the truth of what Bob was saying. And whenever you're talking to a loved one about a delusion, if they say something true, I would validate it. I was looking at them a bit more than you should normally have eye contact with somebody. He was right about that. So I said, Bob, you're right. Apologies. And then the link into something we had done together in the past, which was from a happier time of life. And of course, for Bob, this takes him out of the delusion, maybe if only for a few minutes. But hey, it does give him a break from the delusion as he thinks about that happier time and maybe accesses the memory and the feelings from the past. And who knows, just maybe he'll take that trip down to the pool hall. So what we've seen there is I've turned a very typical paranoid situation into something which is more of an opportunity and something more therapeutic. How did it feel to be on the receiving end of it, Bob?
Well, I felt kind of warmed up and less threatened by your response. It felt kind of, I began to think about, oh, there were some good times.
Yeah. And of course, people with psychosis rarely do that. They're totally locked into the present. You know, the present is scary enough. There's things going on out there. There's people doing things. You can hear them speaking to you. It's pretty scary. And to access that memory from the past is very therapeutic. Now, I think families can do this. Keep taking them back to those times. Keep recalling the times of happiness when you went to the cinema together or you went on that holiday to Florida, whatever it might be. Accessing those memories is a bit of an antidote to the delusion. It weakens it. Not for long, but if you keep using that approach, delusions can start to weaken. Okay. So I thought we would have a little stop at that point and see if anyone has any thoughts, ideas, questions about that first section.
So, Doug, there were a couple of comments. I think some of them are available to everyone here. I'll look at the first one that came to me, which is, it's about the experience of voice hearing. And it's kind of asking, it often seems to be the voice of some other entity or being.
Yeah.
But the question is, can it also refer to actually what the person is thinking, their inner critic, their inner judge? How to think about voices?
Well, this is a very acute point, because as the bit of the brain that produces voices switches off, your inner thoughts are distorted and they appear as if they're outside, and they're laden with emotion. because the bit of the brain, the amygdala that deals with that, has switched off. And so these are really quite distressing, distorted voices. But in amongst those voices, and they do seem alien. They seem like they must be something strange, like an alien or a demon. That they must be just something very unusual. But in amongst it all, you have voices that you recognize. Voices maybe of your grandfather, grandmother, somebody you knew at school. So the voice here, and when you see the voices written down, is a very amazing experience. And part of the trick is to deal with those very painful voices and allow them to come back on board and become thoughts. So that I've seen so many clients do that in working with voice diaries and writing their voices and drawing their voices, that they gradually allow them to come on board and become thoughts and back to the normal mind again. But it's a very, very interesting subject.
I just want to comment that sometimes there can be sort of fluctuating insight where the person in certain moments understands that these are sort of related to their thoughts. And that can vary a lot. In moments of stress, maybe that understanding completely disappears.
Well, people who get very severe voice hearing do say that the voices at times take over and they don't have any insight into it, and they've lost their coping ability. Now, normally that happens when there's been one of these triggers, there's a very strong emotion driving the psychotic symptom, or they're taking cocaine or amphetamine. There's some external factor that drives it. And in that situation, it's really, the secret is to try and catch it before that insight is lost and before the voices are kind of taken over.
Can we do one more question?
Yeah.
Okay, so another question to me was, sometimes voices appear as not so much voices, but as various kinds of sounds. In one case, a high frequency squeaking sound. Can we think of this as the same experience as having a voice, or is it quite different?
That's interesting as well. You can see sometimes that people get tinnitus type sounds. Now, that type of noise almost always worsens voices. So if you get a combination of tinnitus and voices, the tinnitus, because it's white noise, usually worsens the voices. So is that experience a hallucinatory one? Well, I had one patient who heard the noise of a machine and it sounded like a humming sound. And what he believed was that this was a machine being operated by government agents to steal the thoughts out of his mind. So he believed this machine was some kind of thought stealing machine, and he could hear it working. So what was it? Yeah, it must have been a hallucination, but it made sense because there was a delusion there. So it wasn't just on its own, it was part of the delusion. So I would think that I would normally have that kind of symptom. I would get an ENT opinion on that and just check there's not some more physical explanation for a tinnitus experience. Okay.
Okay.
Thank you very much. Great questions. Let's move on. So I was mentioning about coping, and we did a study of people in the community with voice hearing because we wanted to know what their natural coping approaches were. So this is over 300 people. And what you can see in the first bar here is that the majority of people used distraction. Now, when we looked at what they were doing, to distract themselves from voices, there was only that small red bit that was going to work. All the rest of the distraction was making the voices worse. It's amazing. Now, distraction's the least effective way to cope. Focusing and selective listening is much more effective. And some people were doing that. But again, only the little red bit was effective focusing. What was the rest of the blue bit? Well, they were shouting back at the voices. They were focusing on them and telling them to get lost, shut up, get out of their life. Of course, that was just causing more anger. Metacognitive coping is things like acceptance and mindfulness, but those kind of what we know to be the most effective coping styles, and almost nobody was doing it. So what this shows us is people with psychosis left to their own devices do things to cope that make them worse. It's up to us as family members, as mental health professionals, to model how we cope with things. And we hope we've got a good strategy, and then to help them develop a strategy which will work for them. And what works for different people is different for everybody. Do you have a good coping strategy, Bob?
So I think we'll make the point that it has to be really tailored to the individual. And often, right, we find out just by questions what works for you.
Yeah, absolutely.
I'm not sure there's a general coping strategy, but I do think the strategies that incorporate some kind of acceptance and willingness to experience the voices rather than fighting or struggling or becoming very angry are really helpful.
Absolutely. And most of the people in the distraction group there were doing exactly that. They were fighting with those voices, and that won't help them to settle down. So, yeah, I think in our inpatient wards, in our community mental health teams, we need to be teaching people how to find their coping strategy. And you're right, they've probably got one. If you just ask, is there anything that's actually helped in the past? They might be able to come up with something good. But a family member may well have a feel for what that coping strategy might be, because they've watched their loved one their whole life. So what works for one person doesn't work for another. I've had people use the approach of writing the voices down. So I had one chap, he had 5 voices speaking to him, and he would just sit and write down, make notes of them. And then at the end of the day, he would have maybe a couple of pages. He'd read it back through and underline the important bits and bring the diary into me at his next appointment. And he came into me and he said, "Doc, these voices are boring." He had realized that they were just saying the same thing over and over and over again. They were boring, he said. And in that moment, he was ready to overcome them. So writing the voices, what he did next is interesting, because he had a skill in art. He was actually quite a good painter. And he took up art again and made a fabulous recovery. Can other people hear these voices? Most voice hearers think that other people can hear them, and that's why they're so ashamed of them. So we can ask, you seem to be responding to something. Do you want to know if I can hear anything? So we can ask that question and try and help with the experience that way. Can we find out where the voices are coming from? Now, most people say they're coming from a bug which someone's put in my brain, or it's the neighbours. The neighbours are shouting and arguing next door. So can we actually, if we got them standing beside the wall, will these voices sound louder? Because you would think they would do if it was the neighbours arguing. And what will it mean if they don't? What will it mean if they don't get louder? Could we tape record these voices? Now, all of these things are done to get an explanation of what the voices are, to demystify them, to take the pain out of them, to realize that it's a common human experience and that you can cope with them. If there are explanations, can we test them out? I remember one young man who thought a bug had been put in his brain. He did have a small scar above his ear. And he said, how did that scar get there if I didn't have a bug put in by the place? Now, I later found out in his medical records that he had suffered an injury. He'd fallen a railing when he was young, and that was the injury from the railing. But not a good time to tell him that. And what we decided was that the bug would probably be interfered with by a mobile phone. So he decided to start using a mobile phone to see if the voices changed. As we said before, the minute you start scoring and writing things down, they are bound to change. And he started to find that there was fluctuation in the voices. And he started to wonder if it was a bug. So these are all things which are teeing us up to develop some good coping. Modify the environment. Some external noises cause voices. So we had one young man who lived in a busy road, and when he moved to a property away from the road, the voices were much better. The traffic was triggering the voices. And there's lots of different environmental sounds that can trigger voices. A very simple diary, very useful. And is there anything you can do that will bring the voices on or switch them off? Is a good question. Oh, distraction. I would say all of these have worked for somebody over the course of my career. I can think of a lady who was interested in reading novels. That was her hobby. But when she was just reading silently, her voices would get all involved, make a lot of comment. When she read the words out loud, the voices calmed. Now, if you don't like novels, that's not going to work for you, is it? And if you're not any good at art, you probably won't use that as a coping strategy, but there will be something for you which will work. And once you've got a distraction technique, you know you can go out because you can take the edge off of those voices or off of that paranoia by using a technique. Really important. I know of one lady that she was in a choir before her psychosis started. And during COVID, her choir started to sing online. And she found that massively helpful as a coping strategy. She looked forward to these choir singing sessions. And while she was singing, the voices were backed off. And then, moving beyond that, you start to find out what those voices are about, why they're doing it. Because the voices are about something, whether it be an emotion or a memory or a trauma. Drugs, they're about something. Attention shifting. There's a good app for this. And what you do is you train to switch attention. The person listening to voices is often locked into them, or the person with paranoia is thinking about that all the time. But if you practice shifting your attention with different sounds or different pictures, practice doing that regularly, it gets easier to shift attention away from psychosis. Doesn't work for everybody. So what I'm trying to say here is there's lots and lots of things out there that might work. And for your loved one or your client, if you're a mental health professional, we need to experiment and find the one that works for them then. Crucial first stage in recovery. What about this? I mean, I think animals are very therapeutic. Dog, cat, horse, and fish interactions. So I had another young man who was very interested in the horses and spent a lot of time down at the stables with the horses. And that seemed to be a very useful way to cope. And walking the neighbour's dog is good. Some people keep fish and looking after them is good. It depends what works for you. You've got to find your own strategy. Now, the bit of music you heard at the start, you're probably thinking, what on earth is this? Well, this is Mozart's K.448 Piano Concerto in D. And this is an important bit of music because it was discovered in 2020 that it was as good as anticonvulsant medication for treating some people with epilepsy. So this bit of music treats a brain malfunction. How the heck did Mozart know that? I mean, the guy was a genius, no doubt about it. He wrote many incredibly harmonic pieces. But it was the patients with epilepsy, somebody discovered this bit of music and said, I feel a bit better, you know, when I listen to that regular. And it went around a group of people. And then the scientists got hold of it and they said, yeah, it's true. If you listen to this music for a certain amount of time each day, seizure frequency drops. A brain disorder treated by music. Maybe it's not too surprising. But the same thing was found in schizophrenia. People struggling with voices, certain types of music were extremely effective to calm the voices and take the emotional impact out of them. So what I'm thinking about one young man who told me that the Fun-Loving Criminals was the band that he listened to because they could switch his voices off. I don't know if anyone in the audience has ever heard of the Fun-Loving Criminals. They sound terrible, but they're actually a very melodic band. And the track that he took me to a single track, and it's a track called Up on the Hill, for those of you that are interested. And he said, my life is about this track. So he gave me all the clues I needed to find out what his voices were about. And very often people can take you to things like that. But loads of different types of music, people tell me, make a difference to them and to their voices. I don't know what type will help your loved one. Jazz seems to be good. Classical music seems to be good. Most young people won't listen to neither of them, as far as I can see. But certainly very heavy metal, punk, gangster rap, these types of music will make your voices worse, in my experience. So jumbled, non-rhythmic music, the kind of music where you can't quite pick out a rhythm, where there isn't a harmony, and you can't quite hear what the lyrics are, these are bad, not only for voices, but also for seizures. It's interesting, isn't it? So distraction using music is totally on. It's a really good idea. We just needed to have a bit of thought about getting the right type of music. White noise. I mentioned traffic earlier. That's white noise. A fan that's buzzing. Air conditioning can powerfully cause voice hearing. And if you switch it off, the voices can settle. So music as a way of distraction is a really good idea. But we just need to pay attention to the type of music. So everyone needs a distraction strategy because psychosis can overpower you and paralyze you. But once we've got that strategy in place, then we need to work out what these voices are on about. What is this all about? You need to have an explanation for it. And at Marius Rom's idea, psychosis is a burglar alarm and it's going off. And it means that something has happened in your past that you've never processed. Now, for a lot of voice hearers I've met, that is quite accurate. Can we correct the cognitive distortions in the voice? So the person who's focusing on these voices, distracting with music, and the voice says to him, that guy has no friends. He is a complete waste of space. Now that's pretty extreme, really, isn't it? So you could be thinking, well, that voice is really in a bad mood today. There's no need for saying things like that. I do have some friends. I've got Bob that I see in the clinic, and I've got my mum and dad, and I've got my sister. I've got friends, and you should never say that anybody is a complete waste of space. I think that's really not the right way to speak. So those people that recover start to focus on these voices, understand them, and then start to process them. And in that, they've got their emotions more under control. Right. But some people are very, very ashamed of their voices and they won't speak to mum or dad, and they won't speak to their psychologist, and they won't speak to anybody about it. So I'm going to role play one of my patients who that was his perspective in life. And Bob's going to, as my dad, he's been my brother, but now he's going to be my dad, is going to try and get me to talk a bit about it.
Doug, you've been looking kind of really upset, and it seems like maybe you're hearing some voices. What's going on?
What? No. Hey, come on.
Well, maybe I've got it wrong, but I just wanted to. I was
What
thinking
are you
back.
trying to say to me?
Oh, well,
Hearing
sorry,
voices?
Doug. I was
You-
thinking back that
Saying I'm unwell.
I was thinking back about my experiences, and I've heard voices.
Have you?
When
Really?
yeah. When I'm in the shower, and
Huh.
the water is very loud.
Yeah.
I often hear the voice of my wife calling me or the phone ringing.
Really?
And then I stop the shower, I get out. The phone wasn't ringing. No one was calling me.
Oh, that's weird, isn't it?
It's so weird. Yeah, it's happened more than once.
Oh, Bob, I'm so sorry for you.
Yeah,
Did you
it's
have to
kind
go
of
and
it's
did you
kind of
go to
upset.
see
It's
the
pretty upsetting.
did you go to see the psychiatrist?
So I
Because
did because I kind of worked out that the white noise of the shower with just a lot of background noise going on made it.
what?
Yeah. Have you ever had that? Well, there's a lot of noises going on it's easier to hear things.
Oh, well, there is a lot of noise going on. I'll definitely give you that.
Okay.
I don't know what to do. I don't know what to do.
Yeah. Could we talk just a little bit about what's happening, just so I can understand what's going on?
Well, since you've heard stuff before,
Yeah.
I'll tell you a little bit about the ghosts
Oh.
that are talking in the background,
Oh.
and they're saying, I'll tell you, that they're going to hurt you.
Oh, that sounds scary.
That's what they're saying. And I mean, ghosts, like a poltergeist, that type of thing.
That sounds awful.
I feel so bad. I think, I just keep myself locked in the room so that nothing bad happens to anybody.
Yeah, and does that help with the voices?
No.
Oh,
What can we do?
let's try to think of maybe some other things we could do that might help. Yeah. But when you sort of isolate yourself in your room, it doesn't really make the voices any better.
No, you're right, it doesn't. But
Yeah.
it keeps people safe.
Yeah. Well, it sounds like you're working really hard to keep me safe, so I appreciate that. But you
Yeah.
shouldn't have to stay in your room all day.
Okay, so
Oh.
this role play probably needs to be stopped.
Yes.
We've learned a lot of very interesting things. Obviously I was role playing one of my clients, and the voices were saying they were going to kill her family, and she was terrified. And the voices were telling her not to tell anybody about the voices. So those kind of instructions can be happening, and the emotional state of the client was very, very sad, very depressed, very ashamed, very anxious, got a whole mixture of different emotions. But we needed to make Bob's breakthrough there. We needed to find out, because once we found out, we could actually start to explain the kinds of things that people that hear voices do normally hear. So we're able to explain that's exactly the type of thing you can often hear. And there's usually been a reason in your past why that kind of voice would be saying something like that. In this girl's case, it was an episode of bullying at school. So once we made the breakthrough, and I think families in a great position to do what Bob's just done and make the breakthrough, we can then have a chance of making progress. But unless Doug talks about these voices, it's completely stuck, isn't it? Oh, right, we've come to another little stop point. See if there's any questions or ideas.
So one question that's come in is about reality testing for voices. Is this often effective, and when could you use it?
I think it is effective if you use it at the right time. Now, I don't think Bob could use it in that discussion. So I think you need to have a bit of a discussion and start to find out a bit more about the voices. And then you'll come to a point of maybe trying to do some coping. And once you've got your coping strategy, then I would say is a good time to say, you say it's the neighbours. What if we go and listen at the wall? Will the voices be louder then? And that's kind of reality testing of it, or switching on the phone recording and saying, do you think we could record these voices? Will we be able to play them back? So I think it works at the right time. And a lot of these CBT techniques are about pace, doing them nice and slowly, and doing them at the right time. So we don't want to jump in to do something which is ahead of the person. So I think that's my answer to that one.
Yeah, so it sounds like timing is everything, and it sounds like that we don't want to do this in a way that's going to be challenging or that's going to be getting the person feeling that sort of invalidated as well.
Well, in the Doug role play there, if you tried to do it at that point, it would not have worked. And I would have suspected it might have made him worse.
Yeah.
He just wasn't ready for it.
Yeah. So there's a couple other questions about, now was what about use of diaries?
Yeah.
And for this person, the family member has refused to do a diary, and they're kind of asking, what's the right time to reintroduce something like a voice diary, and how would you do that?
This is timing again. I wonder why they're refusing to do it. maybe they're not at that stage of understanding the experience. So you could maybe ask them to listen to Eleanor Longden's TED Talk as she talks about her voices, or go on the Intervoice website and see the vast range of different voice experiences that people have in the lead up. But I think when we model things, that makes a difference at home, you know? So I think if dad is keeping a diary and he shows it to his son and say, oh, I'm actually quite enjoying keeping this diary here because it means I can kind of organize my day, and I might be silly, but I'm putting down whether I'm achieving things or whether I'm failing, and I'm putting down how I'm feeling in the diary. Hey, I'm finding it quite a nice experience. And after sharing that for a while, sometimes the loved one becomes agreeable. So I think that can be a good thing. The other thing is you could have a whiteboard. They might agree to put something up on the whiteboard for each day, draw it up with different colored pens. And they doesn't want to do a diary that's going to be durable, but a whiteboard you can clean might be acceptable. I think these are possibilities.
Yeah, we're getting a lot of questions, Doug. Here's another one about writing. How exactly does writing act as a catharsis? How does writing help when people start writing things down? How do we understand that?
It's a great question, and something I'm interested in, because there's a thing called graphotherapy. And it was discovered that if you're harboring a secret, a painful secret in your mind, that it acts as a poison for you. It starts to affect your mental functioning. And all you've got to do is to write it down on paper, do a page a day, no punctuation, just get it all out in the bit of paper there, burn it or bin it. You don't need to show it to anybody. You are processing that memory onto the page. Now, think about a lot of people with psychosis. We've said the voices and the paranoia are about something that's happened. So, like my young lady who was bullied at school, she needs to be writing about that bullying, and it'll start to process it. And maybe she will never speak to anybody, or maybe after a couple of weeks of writing, she'll come through to her mum and say, Mum, I want you to see something. I want you to see what I've been writing. And it can be a real breakthrough. But that is a great question. I think we need to do more graphotherapy.
And just to make a point, we know that trauma can play a significant part in psychosis, and often narrative writing is a way to process trauma.
Absolutely.
About what's happened.
Yeah, particularly if you're ashamed about what's happened. So many people blame themselves for being bullied. So if you're blaming yourself, you're too ashamed to talk, but you might write. So I think it's a great way to go.
Okay, there's a couple more questions. Do we have time for one more?
Yeah.
Okay, well, there's a lot of great questions I won't be able to get to. Let's just see. So there's a question about, this is a person who they understand what the trauma is that's bothered their son or daughter. But their son refuses to talk about it and refuses to go to a therapist.
Yeah.
And so how do we start opening up a discussion when the person is just not willing to kind of?
I mean, we find in clinical practice that sometimes you just have to wait and just keep trying, just keep presenting the same interpersonal skills so that they know that you're there, they know that you're open to listen. So sometimes I think you just have to wait. Sometimes, it's interesting, a peer support worker, somebody will say something to a peer support worker they won't say to their psychiatrist or their family. So sometimes somebody from the same sort of situation might disclose what they're going through, and the loved one might disclose to them. So peer support workers have an important role, I think. And across the voluntary agencies, I mean, you might find people will disclose to an army member at one of the meetings something that no one else had been told before. So yeah, sometimes you got to wait. Sometimes introducing a different person of a similar age, sometimes peer support worker might work.
Okay. There's many more good questions. I think maybe timing, we should probably move on and we'll try to circle back at the end.
That sounds good, Bob. Let's try and press on. Now, here is a major problem for families and for mental health professionals. What do we do when someone is very, very deluded and they start to be unsure and maybe accuse you of being part of the delusion? So if we had more time, we would role play this with some gusto, but I actually don't think we do have time. But we might come back to some future webinar. In this one, Bob thinks that people in the neighborhood are being replaced by cyborgs. Apparently, these are some kind of robots who are programmed to kill people. And Bob is thinking that his brother Doug is looking a bit like a cyborg on the day he arrives. So, what should we do in the face of these extreme delusions? Well, the first thing I would say is I always talk to people about the delusions. I'm not going to escape from it. If someone is very, very preoccupied and distressed about a subject, it's inhuman not to talk to them about it. So I will say, Ching, you look very frightened today. I'm wondering if you can tell me what's happening. And they'll say, oh, it's these cyborgs. And I'll say, oh, well, I don't know what a cyborg is. Can you tell me more about the cyborgs? And I'm showing a lot of curiosity for the delusional content. Tell me more about this. How can we find out about cyborgs? Which country makes the cyborgs? Is there anything online we can look up about it so we'll get more information? What are they made of, cyborgs? Are they made of metal or are they electronic? How would you know a cyborg? So if we go to the window and look out into the street, there's an old gentleman out there walking his dog. What are we thinking? Does he look a bit like a cyborg, or is there some reason that you might think he's a local resident? This is what Beck did in his very first study in 1952 with a massive, massive delusion. He spoke to the client who had a delusion about CIA persecution, and they started to work out what the persecutors might look like, and then they tested it out by looking at the people in the environment. And gradually, with the Beck approach, the delusion shrunk. Interestingly, as it did, the person with the delusion became really quite sad and with a lot of guilt. So that the delusion was about something. And that's what I'm saying. These delusions are actually about something that's happened. But if we can talk to our loved ones in this way and help them just to explore pieces of evidence around the delusion, it can start to become less distressing. But if Bob is saying, I think you're a cyborg, what can I say? Now, the first thing is that might be a slightly risky statement. So I'm going to have to be aware if there's any risk towards me at this point. But I'll be saying things like, if that were the case, when do you think this change happened? Or what happened to your actual brother, Doug? If you think I'm a cyborg, where's the actual brother? Or was it something that I did or said that made you think that? So all of these need exploration. And here's a good one. Ask me something that only your brother Doug would know. Of course, you might answer cyborgs have stolen all your memories and all of that, but you normally find there are limits to delusions, and you can ask questions around their boundaries. Okay, who was my first and best friend at primary school? Nobody else would know that. Well, I know. It was George Brown, wasn't it? Ah, you're right. It was George Brown. Yeah. That's a bit of a reassurance. Now I'm thinking maybe you're not a cyborg, but I had to be sure. Let's look at some old family photo albums and think about the people we both know from the past. I've been here for 10 minutes now. Are you seeing any kind of cyborg or dangerous behaviors? I think we do something relaxing, because I can see this has been frightening for you. So a whole bunch of techniques you can use if you start to get dragged into the delusion. So for all those relatives who are struggling with a loved one with big delusions, I hope there's something in this little section that you can use. Okay, what about when a loved one is trying to tell you something and you can't understand it because they've got thought disorder? It's mixed up. Could we slow the speech down? I'm sorry, I didn't quite follow that. Could you try and give me that again, just the first bit of it? Would you be okay if I write that down? I'll make a note of it so that I can understand how the first bit ties in with the second bit. And I'm modeling here very slow speech and me writing things in the hope that we can try to slow the speech down. Now, thought linkage is just saying, you jumped from X to Z there. I couldn't follow it. Was there a Y? Was it an X, Y, Z? Was there a bit I missed in the middle? Now, once you start to make sense of what they're trying to say, they get less frustrated, less anxious, and then normally the speech does slow and you can have a dialogue. If it's not working, can we go back to the start of this discussion and try again? With people with very severe thought disorder, I remember making a video, a 20-minute video of the speech and going through it time and again to try and understand what was going on. And in this particular video, it was a medical student who was watching it, who was able to see there were 4 main themes in it, and they'd got all tied up in a knot. Anyway, that's a different case. We won't talk about that one just now. Now, neologisms are very interesting. These are words that don't make sense. They happen when the brain takes half of one word and half of another word and puts them together into a new word. Now, these new words are extremely important. These new words are the very heart of what your loved one is trying to tell you. So I had one young man who told me that he was going to be Sharonified. Sharonified. Oh, wow. I'm thinking, I don't know what that is. Asked him to explain it, and it just didn't make sense. The video showed that he was very concerned about someone who'd been assaulted in his neighborhood. And in Sharonified, he was talking about Sharon, who was the gatekeeper of the underworld. So sometimes people with psychosis can go very deep and get some really quite highly meaningful words that they'll use in our discussion. So it's worthwhile noting them and trying to understand them. Neologisms, very interesting. This is John Frusciante of the Red Hot Chili Peppers. He's got an online diary about his voices. And I used this diary a lot for patients who were about when the Red Hot Chili Peppers were big. They're probably still big. Are they, Bob? Are they still a big band?
They're big with me personally, but I don't think they're current.
So I'm looking for role models within current culture so that people will identify with them. Now, Bob, he's identified with Frusciante, Under the Bridge and all that kind of stuff, and the genius of his guitar playing, but he had severe voice hearing while he was doing all of that. Now, for Bob, that's powerful because he remembers them well and how good they were. But for our younger people today, Frusciante doesn't work. We need to find a new role model. There's lots of them out there. Again, Intervoice on the network, paranoidthoughts.com. You can find examples of voice hearing delusion in modern culture that younger people will identify with. So voices, what do they say? There's lots of different voices going on there. They're the voices that are plainly critical. They're the voices of stigma, the voices of trauma. And you don't normally hear the voice of an abuser. It's normally distorted. Voices that give running commentaries. Then you've got really positive voices in there. The command voices telling the person to cut their wrist or burn their arm are, of course, worrying. And we really would like to know about them because there's good techniques to help. Now, we mentioned a simple voice diary, and I think there's a link here. I'm not going to go into that just now, but a simplest voice diary is just 3 columns. So the first column is time of day, morning, afternoon, or evening. The next column is how troublesome were the voices out of 10. And the last column is what were you doing? So morning, voices 2 out of 10. Cooking the breakfast and reading the paper. Afternoon, voices 8 out of 10. Bored, watching the television. Argued with my neighbour. So you start to see a pattern in voice hearing, and seeing that pattern is very important. Delusions follow similar patterns. You're not as paranoid as that all the time. It fluctuates. So this gives us a way to get into it. If the person won't do it, then we can leave normalizing examples around the house and hope that maybe they might get read. Or I would say dad should keep his own diary, or mum should, and share how the diary has worked for them. I think that's the best way in. Critical and commanding voices are the biggest problem, and unfortunately they are least responsive to antipsychotic medicine. So certain types of voices respond better to medicine. Critical and command respond less well. We would really like to know, for the commanding ones, what type of person, machine, spirit, or creature is producing this voice. They almost always have a very clear idea of what it is. Now, in the Doug role play, it was ghosts. People tend to know what they think is producing the voice. And then the question is, can we draw it? Which is useful. What do we know about it? Can we test its power out? Do these ghosts really have the power to hurt mum and dad? Or are they just saying that? It's an important question. So there are very useful techniques, really, for therapists to use for clients with commanding voices. And Max Birchwood has shown that these techniques are extremely effective. And usually the commanding voices go back into the head and become intrusive thoughts. Critical voices, very common because people with psychosis often have their self-esteem switched off and they're not nurturing the self. And as such, they tend to believe what the voices say. Now, one thing that's true of voices is if the person believes it, the voices just keep going and they feed off it. And this is becoming a type of bullying, isn't it? And in the therapeutic approach, you would ask the client to challenge that level of bullying by any kind of person or creature on another human being. If your self-esteem and self-nurture is switched off, you don't look after yourself and you don't do things for yourself. You don't give yourself kind messages. And of course, the voices and the paranoia feed off that. What can help? Well, families will know positive events from the timeline, things they've done together. For me and Bob, it was playing pool, as in the role play. But there'll be lots of things that you can activate a very different emotion. So the emotion linked to the voices tends to be stereotyped. The emotion that you bring in from a good past memory is a bit of an antidote. So the more you practice remembering that time when you were playing hockey and you scored that hockey goal at the school team, activate that emotion, practice it. And by doing that, self-nurture can be switched on again. You've got to work at it. And usually there is at least one person in a person's life who has been very positive towards them. Let's say it's the grandmother. What would your grandmother say to these voices? Oh, she wouldn't stand for it. She would not stand for it. She would tell them to leave her granddaughter alone. Well, why do we remember that? In fact, let's get a picture of your grandmother and let's have it handy. So you can look at that picture and remember what she would have said. And remember the kind of things that she said to you when you were growing up. Let's write some of these things down. And that could be a compassionate letter to the grandmother about what's going on just now, and compassionate self-talk to try and switch on the nurture of the self. So many different things potentially that can help. Ideas and questions time.
Okay, I'm going to wait for some questions to come in specific to this last bit. There's just a general question, though, about you mentioned several websites and links, and we're going to make sure those are referenced on our website.
Good. Yeah.
Yeah.
Okay. I think, the last bit, there was probably too much in it. So I think it's probably been a bit overwhelming to see that speed of quick material. So we'll let people think about it and maybe pick up questions at some later in this presentation or at some future presentation. Okay, can we intercept relapse? Well, families are great at doing this. And we know this from the research that's been done on family psychoeducation. But what we really want to have, as well as having the communication and the emotional tone perfect in the home, is to know how our loved one will relapse. So if you go back to their first episode, what were the sequence of events? Fairly typical. Relapse signature, okay? First of all, a certain event happens. So it's a triggering event. Then they start not sleeping quite as well. And then there's a little bit of anxiety coming through. We're 2 weeks into this now. And then they're starting to tell you some paranoid thoughts. And then a voice starts. Now, by this time, you're actually accelerating into relapse. So what we're arguing is we need to be aware of the relapse signature. And when that triggering event happens, we're going to be thinking, I wonder if we're going to be okay here. And when you see your loved one's sleep going off, you're thinking, right, I'm going to have to be very aware now that this could be heading in the wrong direction. Because, of course, if you wait too long, what happens is they say, right, I'm stopping my medicine. No more medicine. That's it. Don't need it. and then you're accelerating dramatically into relapse. So what can we do in these early stages? Well, hopefully you're working together with your loved one. You both know the relapse signature and the relapse prevention plan. So maybe do something to improve sleep again. Use sleep hygiene. Might you be allowed to have a small supply of a sleeping medicine? Maybe not anything that would be addictive, that would just help the sleeping pattern to kick in. Could be use coping strategies, could be manage stress. Has the psychiatrist agreed that you could increase your antipsychotic medicine if this relapse prevention situation arises? If so, that's great. If you could have a small increase, that might just make the difference. But if you're not allowed that, you need to really try and get the earliest possible appointment before we plunge. Because once we're in relapse, it's going to be another admission into the hospital. Being admitted is very, very traumatizing. Our inpatient wards have never been so stressful as they are now. We want to prevent admission if we possibly can. I must say, though, some people definitely need admission, but going with this sort of plan, hopefully we can prevent it. Oh, right, good. We've managed to get through nearly to the end of this. These are the two books which I'm kind of built these webinars around these books. One's from 2009, that's the orange one. One from 2019. I think you will find lots of recovery information in there, particularly for families, but also for mental health professionals. And I think you'll find exercises and interesting directions that you as a family can go down. We wrote a good paper on coping strategies. Now, I think it's open access, Bob, so I would hope that you'll be allowed to let people read that, because we put a lot of the stuff in there.
Yes.
Understanding what people think. This is a series of handouts for people, and I think they're very approachable handouts. They're not stigmatizing. It's like, how do you know what someone else is thinking? Because the staring situation was a good example, wasn't it? Bob was reading my mind and he got it completely wrong. He thought I had some hostile intent, but I was thinking something very positive. So that's quite a useful one. If you think about the new directions in psychological treatments, and we've touched on a number of them in this webinar, we list them all in that article. Now, I must say, Nicola Wright's book is a great book, Treating Psychosis, and the downloadable materials on that website are of the highest quality, and you can just go in there and download them. So I hope you will do so to help your CBT-informed caring. Okay, so I don't know if there's any other questions, Bob, or if you want to ask questions, or maybe I can ask you some questions.
Okay, I'll wait for any questions that to pop back, or that we haven't answered that are still out there. Just send me something in the chat. One question is, and I think this is when we were talking about some of the, I'm going to have to scroll back to some of the techniques, some of the sort of positive recall techniques. There was a question, would these techniques work for people who are depressed as well as for people who are psychotic? Deborah, maybe you can chip in here if I didn't understand your question.
What positive recall are we thinking about here? Is this about from the timeline for positive life events?
Actually, what the question came from me, and it wasn't very clear, but what you were talking about was when your loved one is in a very negative state, and how do you improve self-perception? How do you raise esteem? And so the question is, if you have very serious depressions, are they the same techniques as you would use for psychosis and delusions?
Well, depression is so common. across the psychosis spectrum. It and anxiety are probably equally common. And I think if you know your family, you know your timeline, you know the times when they've been really happy and feeling that they've really achieved and been confident, and you know the times when they've been really despairing and kind of feeling that they don't fit in, etc. So yes, so going back and practicing those times and activating that emotion of success and well-being is therapeutic if the person will do it. If they won't do it, then the kind of approaches from compassion-focused therapy at the end there of using a visual image of somebody who was very positive towards you. So I suggested a grandmother there. And interestingly, often people do choose their grandmother as the person who was that beacon who gave them kind of unconditional support. So using that kind of imagery. I had one lady who went and got her grandmother's necklace, and she kept it with her all the time, and she kept thinking the kind of things that her grandmother said to her. And she started to improve in self-esteem and self-nurture. The other thing is to get out the way of all the negativity, isn't it? And this kind of fits with the news, doesn't it? But it also fits with social media, because a lot of the stuff our young people are exposed to is extremely negative. Of course, they don't appreciate social media getting banned, but it could be restricted in some way, just because the messages can be so negative. So the variety of different ways that work for the depression that is kind of inherent for many people with psychosis.
I mean, what makes it so difficult, Doug, is that in the state of deep depression, the person feels that nothing will ever improve, nothing will ever get better. And one of the teaching points is you have to be very careful about challenging that. False optimism, it will get better. I know it'll get better. I have faith in you. And that can often be counterproductive.
Absolutely.
So I think that going back to what used to be fulfilling may be the way around that problem.
Yeah, I think so. I think if we come in with excessive positivity in the present tense, when they feel desperate, they're just thinking, you don't really know me at all, do you? I just feel terrible just now, and I don't think it's going to get better. So in fact, I feel worse now. So that kind of positivity can make it feel worse. I'm aware of staying away from that and very much working with things as they are and trying to build. Yeah, but these techniques should work for that depression.
Thank you.
Okay, so here's a question about a family member who's not psychotic, but they can have extreme reactions, extreme rage and dissociation. And how do you manage these kinds of reactions?
Oh, that's a great question.
Yeah.
So if you're talking about dissociation, I mean, dissociation is the feeling of being outside of your body or watching on at what's happening. So it's the brain's cut-off valve. It just takes you away. And it very often does that when the rage is breaking through. So for that kind of person, usually that diagnosis is about post-traumatic stress disorder, though I don't know the loved one in particular here. It might not be that, it might be something else, but usually that's what it is. And usually the dissociation can be managed by teaching the person to do something in that very short period of time before the dissociation takes the person out of the body. There is a build-up to it, there are emotions there, and it's possible to intercept them. But it sounds to me like there is a trauma there that's trying to make its presence felt. So the people that I've seen like that are people like who have been bullied at school or had, it could be any type of unpleasant, abusive experience from the past. And they put it in the box. They put it in the box at the back of the mind. Life's okay. Yeah, something bad happened. I'll get on with life. Then the box starts to open and the dissociation starts and emotions start appearing, because there's some things that can't be kept in the box. So I suspect that's what's happening here. But it's a very real prospect for therapeutic recovery. I'm not sure that medication is going to do much for that, to be honest. But this is the kind of thing that you work with, Bob, isn't it?
It is, yeah. So thank you, Doug. Here's another question this is really about extreme delusions and paranoia. This goes back to an earlier part of the talk. When your loved one has an extreme kind of delusion that there's a covert operation going on and that family members are participating in it, how do you cope with this without being confrontational, without colluding? How do you take sort of a curious approach? This is really a challenging question, I think.
Well, it is, and it's something that we have to deal with day after day in dealing with people who are acutely delusional, because you have to sit into the delusional dialogue, and it's challenging because you see the person with a delusion has jumped into delusional knowing. They've taken an almighty leap and decided there's a covert operation going on here. They haven't considered all the bits of evidence along the way. So as I curiously speak to them, I'm asking questions about it, and they're trying to pull me into confrontation because the delusion protects itself. It's a very, very interesting question. And what I've got to do is tolerate the difficulty and the pain of that dialogue. And I've got to keep going back. And this is something I normally do in the inpatient wards where I work just now. I keep going back to see them regularly. I give them just small periods of time. It might just be 10 minutes. And I keep going back and keep going back. Gradually, the delusion becomes available for questioning. So I think you've got to take the flak for a while and hang in there. Keep going back, keep showing interest. And what I will often say is, I don't really understand this. Is there something I can read? Is there some homework I can do that would help me understand, pardon me, what you're saying better? And they very often will tell me how to find something, how to read something. And then they'll often want to know what I've discovered. So when the therapist does that bit of homework, it very often does open up a channel for discussion. But I'm not saying this is easy. This isn't easy. This is difficult, particularly for a family member who doesn't deal with delusions day in, day out. It's hard enough for me, and I do. And sometimes I've got to back off. I've got to back off and say, I'll come back and see you tomorrow. And we just decide to call a halt to that day's interaction. So that's the most honest answer I can give. But I would say we do need to talk about delusions and just build up with graded bits of time.
Okay. So here's another question about someone experiencing paranoia, a lot of fear about what the outside world. It doesn't really reach the level of an extreme delusion, but I'm assuming that it's preventing them from doing much. And I'm kind of assuming that, the other part is they're not really willing to talk much about what they're thinking about, what's kind of getting them scared and fearful. What are some CBT strategies that might help, particularly when they're very fearful, but they kind of want to handle it on their own, and they're not really willing to talk about it much? Here's another challenging question for you, Doug.
It sure is. Well, I think that again, I would start by looking at their coping strategy. I wonder if they've got one to actually bring their fear under control a bit. Because there's loads of different things you can do to reduce anxiety. And I wonder if they're doing something that's reducing it or increasing it. So I would like to make sense of that. I would hope to get some idea of what they're frightened about. I mean, this could be a severe agoraphobia. It could be they're just frightened about going out the front door. It might not have a delusion attached to it. But if it has a delusion attached to it, then I wouldn't like to just do desensitization and gradually take them out a bit more with a coping strategy. I'd want to know what it is they're frightened of. And if they won't talk about it again, would they write about it? Just write about it and don't show it to me. You can burn it, you can put it in the bin, you can rip it all up, just to try and get your mind moving with it. It's sometimes people like that really do get quite stuck, and what changes them is a very interesting question. And this goes way back to, I think, our first webinar. What is the recovery trigger? What happened? And if you look into it, sometimes it can be a family member starts doing something differently. It might be something, well, quite small, or it could be that they get a chance, they meet a new friend, or they move accommodation. That can often be the recovery trigger. Variety of possible things.
Just a comment here, I think also going back to some of the befriending, webinar, but some of these befriending techniques can be really helpful for someone who's quite unwilling to talk about what's happening.
Yeah, I think befriending is really underrated. I think it is one of the most useful approaches, not just for families to do, but for mental health professionals to do. We can be befriending our patients. You can befriend your family members. And people are saying, how can you befriend someone you've known all their lives? And I think we can befriend because sometimes it's good to go back to square one and kind of shake off the dust of 30 years and look at a person afresh and say, I wonder what our joint interests are here. I wonder what our shared goal is. I wonder what we were trying to get to. I mean, you can think about
one thing I would just say for the benefit of everybody, there's the webinar that you did in 2020, late 2020, has a whole section on befriending, and they're up on our website. So if people want to go back and refresh some of the principles, they're on our website.
Hey, thanks very much, Deb. But yeah, we did a study, it was way back in the year 2000, and it was about CBT versus befriending for chronic schizophrenia. And we invented befriending for that study because we knew it wouldn't work. And we knew that CBT would win. The befriending was brilliant. They used to come back to me, the therapist, and say that the patients love the befriending. We think you do befriending, then CBT. And that is kind of how it feels now. You need to lay the groundwork of improved self-esteem, improved social skills, and maybe then that the CBT is a bit easier. But yeah, family members, I think befriending is one of the great things they can do.
Right. So the questions just get more difficult, Doug. So this is a question about, I'm assuming, a family member who is really preferring to listen to the voices over reality. They're very, very engaged with the voices and very disengaged from the world. How do you start to help a person who's totally engaged with the voices and turned away from the world?
Well, that is interesting. First question is, are they enjoying the experience or is it dysphoric? So are they angry and sad as these voices are speaking, or are they laughing and enjoying it? Or is it a mixture of both? Is quite an important question. I had a client whose mother was very worried about her. She wasn't coming out of her room. She was spending a lot of her time laughing, and the mother believed that she was listening to voices. So I get one of my therapists to go in and try and do an assessment in the home environment, and the girl wouldn't let her in. So she just sat outside her door, and the girl was laughing, and my therapist said, "I'm still out here, and if you want to chat to me, we can talk anytime." So after 6 sessions of sitting outside the door, my therapist said to me, "Doug, we can't go on like this. I'm not doing anything effective." I said, "I bet you are. I bet you are." And the next time she went in, and the girl said, "Are you still there?" And on that day, she did speak to her. And what she said the voices were a hilarious comedian, better than Billy Connolly, or I don't know who the most famous American comedian is. Robin Williams, maybe. Funniest comedian you can ever think of. I said, "Well, let's get it written down. Let's write a book. Let's make some money out of this." But she appreciated the humor, and I think humor is very useful for all of us working in mental health. However, what happened next was that there was a disclosure of sexual abuse by a teacher. So this kind of like, whoa, this kind of come out of the blue, we didn't quite know what this was all going to turn into, but the voices were about something, and that's what they were about. And when that disclosure came, her mood changed and the voices became much more unpleasant. She started to dissociate. She had a couple of seizures, because that's an extreme form of dissociation. And she responded fully to a combination of cognitive behavioral therapy and EMDR. A fabulous result. We had a delighted mother. It was a mixture of persistent community psychiatry and availability of the kind of expert therapy that you can offer, Bob. It's that combination that delivers. And that's kind of always what you need, isn't it?
Okay, so one more very challenging question. What about family members who just aren't wanting to connect at all? How do you get started with befriending when you've got sort of you're getting a complete rejection or disconnection? Where do you even start?
Well, complete rejection sometimes happens when trust has gone, or it could be because you've had to sign the person into hospital and they're really quite angry with you still. But I would be interested to know what that disconnect is about. Do they have a delusion about you? Are they angry with you for some other reason? There will be something in their mind that's caused that complete disconnect. But anyway, all we can do is apologize about it. Just like I said to you, "I'm sorry, Bob, I was looking at you." And I was just going to say, "I'm sorry, it has been really, really tough. But we need to start again. Can we start again?" And just maybe 5 minutes twice a week of just spending a bit of time together talking about our interests. Because that kind of befriending can lead to healing within a family. But sometimes the anger gets acted out, doesn't it?
Okay, so there aren't too many more new questions. This might be a time to start to wrap up.
Okay, so what are we going to say to wrap this up? Well, I hope there's been something here that's been interesting for everyone that's listened. We've covered a lot of material, so apologies if it has been a bit much, but you can watch the recording and and just try to understand all the different elements of this. Hopefully something will work. Hopefully we can do it with appropriate pace. Whatever we do it nice and slowly. We persevere. We use good interpersonal skills, and just build up nice and slowly. And hopefully some of these things will make a difference. Obviously, you do need your community psychiatrist or your nurse, whoever it is working with your case. And hopefully they'll be supportive of the things that you're trying to do with this. And I don't know how people find that skillful therapist. I mean, there is only one Bob Rice, and presumably you can't cover all the people that want to see you. I mean, do we have a central list of therapists for?
Doug, it's a great question. We're trying to put together sort of a referral list, but the honest answer is right now there's a very small list of people who are well trained in cognitive therapy for psychosis. And it's a big deficit in our community. There's probably just a handful of people on that list right now.
Is that for the Bay Area or for the whole
For the
of
Bay Area? Yeah.
Well, I think we need to get onto that list and try and produce it for people. What is the situation with doing therapy out with California, online therapy? So could you do therapy in New York?
No, so at least for psychology licenses, they're limited to the state that you reside in. So it's within California. You can't do across states.
That's a shame.
It is, yeah.
We have a lot of really good therapists doing online CBT for psychosis.
Yeah.
But I'm presuming that they're not allowed to access people in California and deliver therapy.
Unfortunately, I think that's true. Yeah.
So we need to get our lists together, and we need to. The North American CBT group, I think, is trying to take this forward.
Yes.
There's a
couple resources being offered in the chat, and someone is saying that you have to be licensed in California, but you could live outside of California and treat people in California. But that doesn't help us much, I don't think.
Oh, that is a good point, though.
Yeah.
So a therapist has moved out, and can you be licensed in 2 states?
Yes, you can be licensed in multiple states potentially. Yeah.
So there's obviously a lot of political things that need to happen. So we need NAMI. NAMI's very, very good at this through the national meeting and in various other ways to take the political pressure forwards into the correct arenas. This is evidence-based treatment. Family therapy and what we're hearing about here, cognitive behavioral therapy, is evidence-based. It gets people better. For it not to be available is absolutely ridiculous.
It's shameful, yeah. And I think there's an advocacy role here that family members can play in terms of asking that this treatment be available, that people be properly trained.
Absolutely.
In our county.
We would take that forward as well in any way that it's possible. But there's areas in the UK where you can't get a therapist either. So
yes,
this isn't a perfect situation here by any manner of means. And COVID has just caused massive waiting times across all disorders. And I presume it's the same in the Bay Area.
Yes, yeah. Therapists have been very busy. We should probably go to the last slide about the survey and feedback.
Oh, there we are. Yeah.
Okay. So we just want to, first of all, I want to thank Doug for spending time with us again. And we're so delighted to have him as a kind of international expert. Thank all the family members and any therapists that have joined us today. Please do fill out our survey. The link to the survey is right in your PowerPoint materials here. It'll take just a minute or two, and we really appreciate your feedback. We'd especially like to hear what has been helpful, what's been most helpful, and what you'd like to get more of in terms of future trainings. And then if you've enjoyed this presentation, consider donating to us by checking on the first link. We'd love that. So thank you very much, Doug, for spending time with us again. This has become a familiar and wonderful kind of place to visit, and we just really appreciate the time you spent with us. So I think
Thank
we'll
you,
kind of
Thank you.
close up on that note, and we need to think more about how we can post a list of therapists, because there is no very good credentialing system for therapists right now. Yeah. Okay, so I think we'll say goodbye on that final note. There's a lot of resources coming up in the chat, which I'm going to save here. Thank you all very much for being with us today. We're going to say goodbye.
Bye-bye, everybody. All the
Bye,
best.
everybody. Okay.
We'll see you next time, okay? Bye-bye.